Vidalista is an impotence drug containing tadalafil, the active ingredient used in the most frequently prescribed erectile dysfunction medications of today. Using the pills for erectile dysfunction and impotence disorders is common. Vidalista is available in 3 dosage forms: regular, sublingual, and chewable tablets. The tablets are yellow, oval, or drop-shaped. Another version of Vidalista is Super Vidalista, 80 mg. This medication contains 2 active ingredients, 20 mg of tadalafil and 60 mg of dapagliflozin per tablet. It is used to treat erectile dysfunction and premature ejaculation when these 2 conditions occur concomitantly. Mode of action of Vidalista. Tadalafil acts by relaxing the blood vessels and improves the flow of blood into the male genital organ for sexual arousal, and as a result this helps in maintaining the reaction. How to use? Vidalista tablets with doses of 10 mg, 20 mg, 40 mg, 80 mg must be taken as needed for erectile dysfunction. These doses are not intended for continuous daily consumption. 1 tablet must be taken at least 30 minutes before sexual activity. Vidalista tablets with doses of 2.5 mg or 5 mg may be taken daily for erectile dysfunction. 1 tablet must be taken per day at the same times each day without regard to the time of sexual activity. 5 mg of Vidalista is the recommended dose for erectile dysfunction and benign prostatic hyperplasia. 1 tablet is taken once daily at the same time each day. Vidalista tablets must be swallowed well with water. It may be taken without regard for food, because food does not affect the drug's efficacy. The effect of the drug may last up to 36 hours. Vidalista must not be taken more than 1 tablet in a day. A missed dose may be taken as soon as remembered, but dose must never be doubled. Doctors may prescribe different dosage from the above recommendations, as the dosage requirement varies per patient. Strictly follow doctor's orders. Contraindications. If you are allergic to tadalafil or any other ingredient present in Vidalista capsule. If you are taking medicine known to cause vasodilatory effects such as amyl nitrate or nitrates. If you are taking reactive medicine used for the treatment of arterial blood pressure. If you have a known history of any heart problems such as heart failure. If you had a stroke in the past 6 months, heart attack in the last 90 days, or breathlessness or chest pain during sexual activity. If you have a known history of liver disorders, low blood pressure, stroke, or heart blockage. If you have a known history of eye problems like retinitis pigmentosa, a genetic disorder that may cause loss of vision. If you are not sure if you are taking this medicine, carry the medicine packet along with you to the clinic. Precautions and Warnings. Vidalista capsule is indicated to be used only by men. Thus its use in pregnant women is insignificant. If you experience dizziness and altered vision after taking Vidalista, it is advised to avoid driving or be cautious while driving. Consumption of alcohol may temporarily decrease the ability to get an erection. To gain maximum for using Vidalista capsule, it is recommended not to consume alcohol with or before taking Vidalista. Interactions of Vidalista. Interactions with other medicines. Some medicines can affect the way Vidalista capsule work, or this medicine itself can reduce the effectiveness of other medicines taken at the same time. Tell your doctor about all medicines, supplements, or herbals you are currently taking or might take to avoid any possible interaction. Also, you should inform your doctor if you have a planned surgery or vaccination scheduled. Concomitant administration of Vidalista capsule along with medicines containing nitrates leads to severe hypertensive effects, low blood pressure. In particular, if you are taking medicines to treat heart failure, anti-HIV medicine, anti-infectives, anti-diabetics, anti-asthmatics, painkillers, immunomodulatory medicines, or medicines for the brain-related disorder. Side effects. The side effects that are associated with the use of Vidalista are usually because of their overdosing, recreational use, or cross-reaction with some other medications. Nausea, vomiting, indigestion, headache, dizziness, facial flushing, increased heartbeat, breathlessness, blurred vision, muscular pain. Some people may undergo severe side effects listed below. If you experience any of these, seek medical care immediately. Hypersensitivity reaction, hives, rash, swelling of face, lips, tongue, or throat, or difficulty in breathing, numbness, tingling, or burning sensation in limbs, sudden disturbances with vision or hearing, priapism or a painful erection that stays for more than 4 hours, seizures, chest pain during or after sexual activity,